Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, coming up here at Gold this year, if you haven't seen already, get excited, friends, because we have our Labor and Delivery Symposium. It is backed by popular demand. It's an area that we know that you appreciate and love. So many of you dedicated to this area. And if you haven't seen it yet, well, you should definitely check it out. You can head over to goldlearning.com right now. I'll tell you that Rebecca Decker is going to be here with us live. And it is an open access presentation. That's right. You're not going to want to miss out on that. And all you need to do is register. So if you want to know all the details of what's coming up with Rebecca's presentation, head over to the website and you can check it out at goldlearning.com. But let me tell you what else is coming up. We've got Mandy Rempfer-Kuncio, who's going to be with us. Thank you so much, Mandy, for being with us here today. You have such an amazing presentation coming up. I've got to see the inside scoop, friends, so I know what's coming. But Mandy, why don't you introduce yourself to everyone here today and just tell them a little bit about yourself?
Well, thank you so much for having me, Fiona. As you mentioned, my name is Mandy Rempfer-Kuncio, and I'm a pelvic and reproductive physiotherapist. And I have been for quite some time, past 15 years, coming on 20, pretty quick. I'm also a certified birth doula, so one might say I'm passionate about the pelvis. It's definitely one of my favorite things to talk about.
Yeah.
Beyond that, I'm also a mom of three, so
Oh,
babies definitely matter to me.
yeah, absolutely. And Mandy, you're going to be talking about the ups and downs of birth positions, pelvic biomechanics, birth and pelvic floor. So, in your presentation, what I noticed is there's a lot of detail. And so the care and, the care that you've taken, it sort of resonates with me in the sense that not only are you passionate, but it really is, there's a lot of nuance in that behavior of birth. And I think sometimes we just miss it. We don't see it or we don't know about it. I think you're really going to sort of open up the lid on all of those things for us during our presentation. Tell me how and when you started to see all of that behavior for like that big picture. When did it start to sort of open up for you in terms of seeing all that nuanced behavior?
I feel like physiotherapists are often motivated by experiences in their own bodies, and I would definitely be one of those. So, my eldest is turning 16. She was born a while
Oh,
ago, but
wow. Yeah.
it was even, I think, my first birth that was a tricky one that started me on the journey of certainly learning more.
Right.
And then having the opportunity to start working with pregnant and birthing folks through my clinical practice just really sparked this interest to learn more about the pelvis and
Mm,
biomechanics. And biomechanics is definitely a physio language, something that we
right.
like to talk a lot about. But the flip side of my job is that I help folks who've experienced trauma and
Mm,
injury. And I was just starting to see far too much of that in my clinical
right.
practice and really felt motivated to figure out, are there any other things we could do or things that could be different?
Right.
I think it's important to always acknowledge there's an element of mystery surrounding birth, pieces that are unpredictable and that we don't know
Hmm.
about, but there are some pieces under our control. And so I really feel passionate about helping people learn the tools and the tricks that are under our influence.
Yeah, absolutely. And I guess, yeah, there's a lot of gratitude, I think, today in the terms that we've started talking about, supporting the pelvic floor post-birth, when there has been injury, because for a long time we actually haven't had anywhere to go, or we haven't known about it, should we say? Because I think, physiotherapists might argue that they've always been available, but haven't really been well known to sort of help with that support. But you definitely are about preventative medicine. You're looking at, what we can do so we don't end up in those situations either ourselves, because, a lot of birth workers do experience, situations, as you mentioned, but for our clients as well. Tell me a little bit about, when you start to teach what you've learned, because I think that, there might be an attitude of thinking that maybe we do know, maybe we have the experience, that, over these years. But I think it seems like we really are learning more and more as the research starts to come out. You have a whole different lens, I feel, in terms, and it's so complementary, to what we do as birth workers. So tell me some of the experiences and the feedback that you've gotten from, say, some of the folks that have come to listen to your lectures.
It's often touted as the missing piece. So often when I teach, people are like, "Ah, I didn't get this anywhere else." So when I
Right.
teach birthers and birthing families, they're always like, "This wasn't covered in my prenatal class. No one told me,
Hmm.
about the nuances of these positions, or, how we can use potentially biomechanics and other techniques and tools to help." I feel like birth is just accompanied by so many moving pieces and
Right.
so many influencing factors that different care providers definitely have different lenses. And we can kind
Hmm.
of be on the medical side or in the physiology side. But I feel like as humans, we all have bodies that move, and that's a piece that's sort of resonant for everyone. And
Right.
it's nice to put um, a bit of empowerment back in the hands of a birther, right? To allow them to use their body and move in ways that can be
Hmm.
supportive and helpful.
Yeah, absolutely. I feel like your presentation is actually giving us tools for our toolbox, which is what we're always looking for. It's not just the research or the practical or, the physiology of the body. You're actually providing tools, which is great. The clinical tools that we all want, when we go and work with our clients for sure. Tell me a little bit about, again, what has changed for you over the years in your line of work as a physiotherapist? Because I imagine that you getting the exposure now in the birth field, it hasn't always been the same way. So tell me about your experience of just kind of moving into this area and how it's sort of, again, your passion hasn't dropped off anywhere at all, Mandy. If anything, it seems like it's ramping up in terms of, care and management of getting the word out.
Well, I think a little bit of what you spoke to before, Fiona, about how pelvic physio often seems a newer a
Hmm.
newer field. When I started 15, 20 years ago, there weren't very many of us. I was definitely one
Right.
of maybe a handful in the city that I live in. And
Yeah.
it's definitely exploded in terms of availability and therapists who are trained. But we're
Hmm.
still new kids on the block when it comes
Right.
to birth and when it comes to pregnancy and postpartum. But I feel like we do have a complementary knowledge and skill set that suits birth and the process and the physiology and everything that goes along with that. So to me, it is new and exciting because we're just kind of figuring out our pathway and our role here. But the research is also changing. Previously, we didn't even really look that deeply into birth positions. But as technology changes, we have other ways of assessing the pelvis in more
Right.
objective measures that didn't exist before. So we can actually look at someone's pelvis in real time during birth with an MRI at times. There's research studies that actually show us that. And it gives us
Wow.
this really interesting window that we never had before. And some fields of medicine are slow to adopt and adapt
Hmm.
research findings. And maybe we could consider possibly obstetrics in that at times.
Right.
But to me, it's really helpful to see that a confirmation of maybe some more traditional wisdoms that have existed in the past, or B, just this idea that actually we know more, so we can
Hmm.
adopt and change our practices to be more helpful.
Yeah, absolutely. I think what I love about your work the most is that it applies to anybody that's birthing anywhere. So this is not nuanced type of birth. This is not birth at home, birth at hospital, or wherever people are choosing. This is more about the body. This is about preventative medicine, and not only that, but long-term care, in terms of what we're looking at, which I think everyone should be investing in. And so yeah, is that sort of the buy-in that you look at when you're teaching is, this is about long-term solutions in terms of care.
Absolutely. When we look at pelvic floor dysfunction and pelvic floor disorders, the prevalence is enormous. If
Hmm.
you've had a baby, there's a 50% chance you're going to have some challenges down the road, whether it be with bladder leakage or pelvic organ prolapse. These things affect our lives for the rest of our lives because we only
Right.
get one pelvis that has to last us until
Mhm.
our elder years. And
Right.
as a person with a uterus or a female body, we are going to experience the changes within our bodies at pregnancy and birth, but another
Mhm.
major change around menopause. And one of the challenging things about that is a lot of challenges don't show up until menopause. So
Right.
people don't realize it was their birth experience that
Mm.
potentially set them up for challenges that develop down the road. So
Right.
again, that ounce of prevention is worth a pound of cure. If we could improve how people birth and so that they are happier in their pelvis and more
Right.
functional in their bodies in the postpartum period, it actually means a ton for how we
Mm.
age and how we go into our elder years. So, to me, this is the window where we absolutely need to take action. I want to
Mm.
see those stats of pelvic floor dysfunction drop. They're far
Right.
too high in
Yeah.
Western countries, and I think we absolutely could have a positive influence on them. And this is a step towards that.
Oh, that's absolutely wonderful. Yeah, it just seems like you really are the thread in the lots of gaps that we have. I think there's a big disconnect between, in womanhood as a whole, women who, are persons that have uteruses, there's a disconnect. We don't think about what's going to happen in years to come. And knowing that that can directly, or it might not show up until that time, is such valuable information. Mandy, thank you so much for being here with me today. It's been fabulous talking to you. I can't wait, to hear some more from you as well during the presentation, of course. And for all of you listening in, you'll be able to go over to the website right now to goldlearning.com and register not only for Mandy's presentation, but for the whole symposium. We can't wait to see you there. Mandy, thank you for joining me here today. It's been wonderful chatting with you.
Thanks for having me, Fiona. I can't wait to see all the presentations. I'm excited.
And thank you to our viewers once again for listening in. We'll look forward to seeing you all very soon. Bye bye for now, everyone.